Let us discuss the determinants of health. As nurses, it is important because it helps us understand what really shapes health, what truly affects a person's or a population's health, and more importantly, how we as nurses can play a vital role in addressing these factors. What are determinants of health? What are determinants of health? These are factors that influence an individual's or population's health. These can be personal, social, environmental, economic, or political. These determinants go beyond access to healthcare or genetics. For instance, even if we have a hospital nearby, eh, but if a person cannot afford transportation or is not educated about when to seek help, their health will still suffer. Lastly, health is shaped by a complex interplay of various factors. These don't act alone, they interact with and influence each other. One example in our country is a mother living in an informal settlement. She may experience health risks due to poor sanitation, limited education, and a lack of affordable, nutritious food. So, her situation and, of course, her family's can't be fixed with medicine alone. Determinants of health are usually grouped into five main categories. Biological determinants are the things we inherit: our age, our sex, and of course, our genes. Our behavioral determinants include our lifestyle choices, like what we eat or whether we have vices like smoking or drinking alcohol. Our social environment also plays a role. Our relationships, our income level, our education, and our place in society. The physical environment includes the air we breathe, the water we drink, and the infrastructure around us. One of the determinants of health are the policies and interventions available. These include laws and government programs that affect access to care or health behavior. All of these determinants, biology, behaviors, social environment, physical environment, policies, and interventions affect each other and contribute to the health condition of everyone in the community. That is why when we plan our interventions, we must address more than just the clinical symptoms. We must look at the whole ecosystem of health. Let us start with the biological determinants. Let us This refers to our genetic and physiological characteristics. These are the things we are born with or develop naturally as we age. This includes age. As people grow older, they become more prone to non communicable diseases like hypertension, arthritis, or even cognitive decline. Our sex could also affect our vulnerability towards certain diseases, as men and women could be affected differently. For instance, cervical cancer only affects women, while prostate cancer only affects men. These also include inherited conditions. Some families pass down conditions like asthma, diabetes, or even rare blood disorders. In some parts of our country and in the world, there are regional genetic disorders. Biological determinants are mostly considered non modifiable, meaning we cannot readily change them. You can choose your age, your sex, or your genetic traits, but they do have a significant influence on your health. While we cannot change biology, and as nurses, we need to consider it when planning care. For example, knowing that elderly clients are more likely to experience adverse drug reactions means we monitor them more closely during treatment. Behavioral determinants are one of the most modifiable determinants of health. Behavior refers to the individual lifestyle choices that people make. These choices can protect health or increase the risk of diseases. These include our diet and nutrition. Many Filipinos eat rice heavy meals with very few vegetables or fruits. In urban areas, fast food is convenient but usually high in fat, sugar, and sodium. These could lead to problems like obesity and heart disease. Second is physical activity. Jobs that involve long hours sitting, like in BPO centers, combined with limited recreational spaces, reduce people's physical movement. Also, behavior includes smoking, alcohol, and drug use. This is despite awareness campaigns, and smoking remains high, especially among males. Alcohol consumption is culturally common in social gatherings. Illicit drug use, although less common, has serious health and legal implications. Another behavioral determinant is adherence to medication. A hypertensive patient may stop taking maintenance meds once they feel okay, not realizing the danger of silent organ damage. These behaviors can be influenced through education and support. What about the social environment? What about The social environment encompasses relationships, cultural norms, income, education, and refers to the people, systems, and norms that surround an individual. Here we have family support. In the Philippines, family is often the first source of care. A strong support system can help a patient stick to treatment or recover faster. But lack of it, say for a solo parent or elderly living alone, can lead to neglect or poor self care. These determinants also include peer influence. Teenagers are especially affected by this. If their peers smoke, drink, or skip school, they may be tempted to do the same. Conversely, being part of a church youth group or barkada with healthy habits can protect them. Social environment also includes workplace or school conditions. A safe, respectful environment promotes mental and physical health. For example, teachers in overcrowded schools or factory workers exposed to unsafe chemicals are at risk for burnout or illness. Social environment also include social class and in some instances discrimination. Lower income families may avoid hospitals due to fear of expenses. Members of minority groups like indigenous peoples or LGBTQ plus individuals may face judgment or bias, leading to delayed care or poorer outcomes. Understanding the social environment allows us to tailor our nursing interventions with cultural sensitivity and empathy. Physical environment, on the other hand, physical environment includes both natural and man made environment or surroundings. Within this determinant includes housing quality. Poor ventilation, leaking roofs, and overcrowding can lead to respiratory infections or the spread of communicable diseases like tuberculosis. Air and water safety. In some provinces, especially during dry seasons, clean water is hard to access. Poor air quality in congested cities like Metro Manila increases the risk of asthma and other lung problems. Waste management. In some barangays, improper garbage disposal results in mosquito breeding sites, leading to dengue outbreaks. Infrastructure. Poor roads and lack of transportation prevent timely access to health centers. For example, people in upland sitios or barangays might walk hours to reach a barangay health station or needs a higher amount to reach these healthcare facilities. Environmental conditions are public health issues. Nurses play a key role in environmental health education and reporting issues to LGUs for action. Policies and interventions are also determinants of health. These are the laws and the rules and health programs implemented by the government or institutions to improve health outcomes. We have many health policies and interventions. We have the tobacco control laws. These include graphic health warnings on cigarette packs and the prohibition of smoking in public areas. This was aimed to help reduce smoking prevalence, but implementation varies. We also have the Universal Health Care Act. This 2019 law aims to ensure that all Filipinos can access quality health services without financial hardship. It includes automatic enrollment into PhilHealth and expanded primary care benefits. We also have immunization programs. These are vital for protecting children against deadly diseases. However, challenges like vaccine hesitancy due to the Dengvaxia controversy have led to declining rates and measles outbreaks. We also have the reproductive health law. This supports access to family planning, maternal care, and sexuality education. It's especially helpful in reducing teen pregnancies and maternal mortality, particularly in underserved areas. Nurses are at the front line of implementing these policies. We don't just follow protocols, we also help monitor gaps and advocate for change. So, what is our role in all these determinants? So, what we provide health education that fits the client's behavior and social context. For example, teaching nutrition in a barangay where people rely on fast foods, and we should focus on affordable and available options. We advocate for cleaner environments, like organizing cleanup drives, educating about solid waste management, or coordinating with LGUs about drainage and sanitation. We also help our clients access community resources such as physical checkups, health screening, field health benefits, feeding programs, or even mental health counseling. We participate in policy implementation by reporting data, participating in immunization drives, and contributing to barangay health planning. In short, nurses are both caregivers and change makers. We bridge the clinical and the community. In this discussion on determinants of health, we learned that health is shaped by multiple interrelated factors. By understanding these factors, we can deliver care that is holistic and equitable, one that looks beyond the disease and addresses root causes. As nurses, we are not passive observers. We are key players in addressing all five determinants of health through our practice, our voice, and our leadership. Let us take this knowledge and apply it as we care for individuals and families and communities, not just to treat illness, but to create healthier environments and systems for all.